What are the hot topics in HIV currently?
Well, it's a field that never runs out of energy in terms of new things to say, new treatments to give, new avenues to explore in both basic science and applied science. If you ask me specifically how does this relate to things that are going to happen soon, I would say that, first of all, I think we saw that the pipeline is quite rich considering where we are with drugs that seem to work and work well. And I think we were all worried that we would not have a rich pipeline, but we do. We have a good pipeline. The newest drug on the horizon that's now approved is dolutegravir. And that seems to be winning a lot in a lot of categories. I think we have a lot of issues regarding the cure because this has been identified as a national major goal by the President of the United States with resources to achieve that goal. But it's on the base of one patient, the Berlin patient, who was cured with a procedure that can't be done in other patients. So that's going to be a huge hurdle to jump over. And one of the questions that comes up is how are we going to allocate resource dollars on the basis of priorities in terms of immediate needs versus the long-term great goal of cure. Cost in the United States has become a major issue because a lot of drugs are becoming generic. And therefore, all of a sudden, we've got to deal with the issue of drugs that are expensive but convenient. It will not be a question of potency, but it'll be a question of are we going to be forced to use drugs that are not necessarily preferred by the patient because of inconvenience versus drugs that are much cheaper and therefore going to be preferred by the payer. And that's going to vary by state in the United States, and I don't know what's going to happen in the rest of the world. Hepatitis C treatment is one of the great stories of medical history. I mean, it's just amazing what's happened. So I didn't talk about HCV except briefly, but a lot of our patients are co-infected, so that it applies to our co-infected patients as well. But HCV has suddenly become and dramatically become a curable chronic viral infection. First chronic viral infection to ever be cured. It's an amazing success story. So I think if those are probably the major stories that I would highlight at the present time. Some new laboratory testing in the United States for HIV detection with a new test that's going to detect antigen as well as antibody. That will be a major advance. And a lot of smaller issues that I would not have time to go into.